Welcome to Week 8, Part 1, Women's Health. This week we are going to look at the importance of women's health to individuals, families, and communities. We're going to describe the determinants of health with respect to women and how they vary in different settings. We'll look at the burden of disease for women worldwide, and we'll focus in on women in low and middle income countries and discuss those critical strategies for improving health for women in low and middle income countries. Women face a number of unique health problems, and if you look at this diagram here, you can see some of them. There's unjustifiable differences in the health of men and women. There are enormous social and economic consequences on the affected women, families, and societies, and so the health of children depends in many ways on the health of their mother. There are low-cost interventions that could lead to or that could avert many deaths and DALYs. Investing in the education and health of women leads to overall social and economic development, and we saw that in some of our case studies that we've already reviewed in this course. And women are victims of discrimination. And if you look at the SDGs, women's health is closely linked with the SDGs. So let's look at the determinants of health. If we look at biological determinants, we know that iron deficiency anemia is related to menstruation. Women have complications from pregnancy. They have an increased susceptibility to some STIs. And health reasons such as ovarian cancer, cervical cancer are specific to women for biological reasons. If we look at the social determinants, there is a male preference. A male preference is sometimes expressed through female abortion or infanticide. And so we see that in some countries where there's a preference for men over women. Young female children often are fed less nutritious food than male children, which can have serious long-term effects. They have low social status linked to physical and sexual abuse and also depression. The household rules can lead women to be involved in cooking with poor ventilation indoors, and those are associated with respiratory diseases, and we've touched on that already. And poverty and lack of or low levels of education and low social status limit their access to health care. If we look at the burden of health conditions between low and middle income countries, you can see the top two are related to non-communicable diseases, lower respiratory infection, typically from cooking over those open stoves or open fires. And that's also related to ischemic heart disease. You have diarrheal diseases from water and sanitation issues. And then you get into stroke, malaria, you get into your infectious diseases, and neonatal encephalopathy, and a neonatal preterm birth. So you can see the differences and similarities between low and middle income countries. Now those change as you get into the higher income countries where you see that it's really related to non-communicable diseases. So everything down here is related to non-communicable diseases, and these lower respiratory infections are probably related to asthma and COPD. If we looked at the DALYs for low and middle income countries, one of the biggest DALYs is malaria for women in low income countries. But as you go through, you're starting to see some of the similar, as we know, ischemic heart disease is the /1 killer for women. And you start to see those lower respiratory infections and diarrheal diseases related to environmental issues, HIV, AIDS, dietary iron deficiency. So, I mean, you can start to look down this list. But again, as you relate it to upper or high income countries, again, these are all related to non-communicable diseases, where women here, you can see it's really a double burden of disease, that they're really suffering from both non-communicable diseases, but also communicable diseases as well. And there's a lot of low back and neck pain as well for women because of the hard work. And so if we look at the leading risk factors, across the board is high blood pressure. So very important to make sure that all women are checked for high blood pressure. And then in the low income to the high income, again, you're looking at household air pollution, low birth weight and short gestation for really a baby who's born female. And you can see other areas, child growth failure, unsafe sex for women in low middle income countries. And then you start to get into the environmental issues. And then here in the high income, the risk factors, again, you can see they're all related to non-communicable diseases. And so again, you see that double burden of disease with women in low middle income countries. Some of the key differences between the health of men and women. Well, an analysis identified 19 conditions that disproportionately affect women. And they are specific to women, related to women's higher life expectancy, and they could also be a result of gender discrimination. But you may not know that Alzheimer's disease is a higher ranked cause of death for females over males, and there's a higher rate of dietary iron deficiency among women, among others. If we look at sex-selective abortion, and so that's the practice of aborting a fetus after a determination that the fetus is an undesired sex, typically female. And we see the skewed ratios here of males to females in some country. So in India, there's 900 females born for every 1,000 males. In China, there's 870 females born for every 1,000 males. It's important to think about another burden of disease, so female genital mutilation, and that's the traditional practice that are all related to the cutting of the female genital organs. And it's estimated that 200 million females worldwide have had some form of genital cutting. It's very closely related to ethnicity. The practice does appear to be diminishing, but it can lead to shock, infection, or hemorrhage. And the long-term problems include retention of urine, infertility, and obstructed labor. If we look at sexually transmitted infections, women are biologically more susceptible. The risk factors for women include a younger age, sex with high-risk partners, and inability to negotiate condom use. And there's an estimated 53,000 cases of HPV a year that cause about 270,000 cervical cancer deaths a year. And so the importance of vaccinating women and men, though, now we're vaccinating men as well, young men, against HPV. Women are also at risk for more violence and sexual abuse against women. So the UN AIDS estimates that 10 to 50% of women worldwide have been abused by a partner. It can lead to injuries, unwanted pregnancies, STIs, depression, disability, and death. And risk factors for sexual abuse and violence against women include low socioeconomic status, young age of the male partner, and gender inequality. And then maternal morbidity and mortality. There's about 300,000 maternal deaths annually, and about 60% of all maternal deaths occur in these 10 countries, so low middle income countries. And birth is the greatest time for risk for mother and baby in these areas. 28% of the maternal deaths are from obstructed labor and indirect causes, and 80% are from direct causes. A woman in a high-income country has only about a 1 in 3,300 chance of dying a maternal death, compared to 1 in 36 chance for a woman in sub-Saharan Africa. So this is looking at the maternal mortality ratio and lifetime risk of dying a maternal death, and so very similar to what I've already showed you. And so you can see that in sub-Saharan Africa, the maternal mortality ratio is 547, and the lifetime risk is 1 in 36. But when we get into the high-income countries, you can see that high-income countries, the mortality ratio is about 17%, and it's a 1 in 3,300. So as I've said on the previous slide. What are the global causes of death? So I alluded to some of these. And so you've got abortion complications, blood clots, embolism, hemorrhage, hypertensive disorders, sepsis, and other direct causes. And so a lot of these can be mitigated by having women cared for prenatally and ensuring that they get to hospital. And remember, I spoke about the LIATA program that is part of the program that I work with, and it focuses on neonatal mortality, but also focuses on maternal mortality as well. Unsafe abortion is also a burden of health conditions for women, and safe abortions are performed by trained healthcare providers with proper equipment, technique, and sanitary standards. But only about 55 abortions are safe. Unsafe abortions are associated with 13% of maternal deaths, and there are about 25 million unsafe abortions each year. If we again look at where this is happening, so this is the proportion of abortions that are unsafe. So there's only about 14% that are unsafe in, let's say, Eastern Europe. But when you get into Western Africa and Middle Africa, you can see that they almost go up to 88%. Some of the health conditions for women related to birth and just being a woman in low middle income countries. One is obstetric fistula, and it's an injury in the birth canal that allows leakage from the bladder or rectum into the vagina, leaving a woman permanently incontinent. And it's due to a woman not having proper labor and delivery care. And so, as I said, it's a condition in which a hole or a fistula opens up between the vagina and either the bladder or rectum. And it occurs in about 50 to 100,000 women each year suffer from a fistula. Women with fistulas are often stigmatized or abandoned because they're constantly leaking urine or stool. And the risk factors are those associated with an obstructed delivery, so not having good labor and delivery care. So what are the overall cost and consequences of women's health problems? Well, violence, STIs, and fistula tend to isolate women socially. When a woman dies in childbirth, her family is typically left without a primary caregiver. Newborns are also at a greater risk of death following a mother dying during childbirth, and there are substantial economic costs from women's health issues. So how do we address these future challenges? Well, we can start off by enhancing the health of women in low and middle income countries. And by doing that, it needs a multifaceted approach. So looking at the enhancement of nutritional status, looking at cost-effective approaches to reduce the burden of communicable diseases, having greater access to family planning, quality prenatal care, and quality obstetric care, and addressing those leading causes of disability and death that go beyond reproductive health. So when we looked at the ischemic heart disease, the incidence of high blood pressure, the women who have respiratory problems because they're cooking over an open stove. And so the multifaceted approach that needs to address the burden of non-communicable diseases. So looking at diet, looking at hypertension, looking at whether women have diabetes. And there's a lot of cost-effective interventions for prevention of heart disease and stroke. And we know that in our high-income countries, and we know that we can apply those primary and secondary screening that can happen for women in low middle-income countries. Female genital mutilation. So we need to look at efforts that promote the change needed to specifically tailor those changes to local practices and beliefs, promote more female empowerment, education, and control over their economic resources so they feel like they are in power. When we look at addressing intimate partner violence, look at changing the norms. And are there examples from any country of widespread change in norms? What factors can contribute to the change? And so this is a billboard in a country in West Africa that's showcasing that this can't happen. And look at these children sitting here and watching this. And so they're really raising awareness of intimate partner violence. And so violence against women. There's limited evidence overall about what works, but there can be protection of women through legislation, providing shelters for abused women, ensure that police, judges, and healthcare workers are trained in effective methods, and promote community-based change of norms. And so that would go back to this type of awareness, putting this large billboard, bringing awareness to intimate partner violence. So these are some other suggestions. So again, prevention and education campaigns to increase awareness, treatment for those who engage in intimate partner violence, so maybe treatment for the male partner, programs to strengthen ties to jobs and families, couples counseling, shelters and crisis centers for battered women, and mandatory arrests for offenders. If we look at STIs, again, the focus on prevention and surveillance, promoting health education, training health workers to provide proper treatment of infection, establishing a system of partner notification. And so that's something that we do when we're treating a woman with an STI in our clinics, is that we not only give her treatment, we also give her enough treatment to give to her partner. And then ensuring access to health services. So what about addressing the future challenges with respect to maternal mortality? Well, the first is to ensure that abortions are safe and there's appropriate post-abortion care. Improving adolescent and maternal nutrition is very important for maternal mortality. Provide effective family planning. Ensure there's skilled birth attendants, and address the 3 delays. So the 3 delays in a woman getting to hospital are a delay in deciding to seek care, a delay in identifying the problems and transporting the woman to a hospital, and a delay in providing appropriate and high quality emergency obstetrical care in the hospital. And so looking at those 3 delays that could cause a woman to die in childbirth. A little bit about family planning. Studies show that women in regions like sub-Saharan Africa would like to avoid pregnancy, but do not have the needed access to family planning. So that's important. Delaying the age of first birth and increasing birth intervals and reducing the number of births is also really important with respect to family planning. Family planning is also cost-effective investment to reduce maternal morbidity and mortality. And this is something that we're actually bringing into our clinics, is looking at family planning and bringing in the husbands as well. So these are just some overall essential interventions for women's health. And we've already talked about most of these already. So sex education, nutrition education, promotion of care seeking for antenatal care and delivery, prevention of sexual and reproductive tract infections, prevention of FGM, prevention of gender-based violence, information about cervical cancer and screening, and then a little bit about looking at folic acid supplementation for dietary, immunizations, and contraception. So these are all just ways to look at how you can deliver information and education and service delivery through community health workers, a primary health care system, and a first level hospital. So looking at the different levels of care that can be provided. So what are the main messages? Well, first, the health of females is a reflection of biological susceptibility and gender norms. Health of females also reflects gender gaps in health systems. Improving the health of females, especially in low-income countries, will require social and public health measures. In low-income countries, communicable diseases such as HIV, AIDS, TB, malaria, and maternal causes continue to be leading causes of death of females. In middle-income countries, non-communicable disease and injuries rise as a leading cause of death of females. And in high-income countries, self-harm, drug use disorders, road injuries, and ischemic heart disease are leading causes of death among females. Violence against women is also a central cause of ill health for women. About 300,000 women die each year of maternal causes. About 40,000 are due to unsafe abortions. Complicated labor, if not properly attended to, can lead to problems such as obstetric fistula, from which an estimated 2 million women suffer worldwide.
STIs are an important cause of DALYs for women, especially in sub-Saharan Africa. And FGM is associated with important morbidity and disability for women. Improving the health status of females will require attention to nutrition, sex-selective abortion, and discriminatory healthcare practices. There's an unmet demand for access to family planning, and maternal morbidity and mortality have substantial economic implications. So for family and for the children of the family. Implementing quality packages that address communicable and non-communicable diseases are critical to addressing women's health, especially in low middle-income countries. And we looked at about what that package should include. So looking at nutritional status, family planning, prenatal and obstetric care, looking at hypertension and diabetes, the cost-effective interventions for secondary prevention of heart disease and stroke. And lastly, poverty, lack of or low levels of education, and low social status limit access to health care. Efforts that promote change need to be specifically tailored to local practices and beliefs. Remember, getting back to that community level, what works for that community. And it's important to promote female empowerment, education, and control over economic resources.